Hi, my name is Dr. Peter Lee, and I'm a board-certified plastic surgeon. I've been in practice for almost 20 years now. Here in Southern California, concentrating on a broad scope of cosmetic aesthetic procedures that we do. Today what I wanted to talk about was gluteal augmentation, or to put it in a little bit more of a layman's term, butt implants. The breast augmentation and using implant for the breast has been obviously widely accepted. But in terms of buttock implants, currently the mainstay of treatment for that is fat grafting. Fat grafting for the butt is synonymous with Brazilian butt lift. And that has certainly gained a lot of traction. It's certainly one of our very popular procedures. However, fat grafting in general, although it is a very powerful tool, sometimes it's either insufficient or the patient's not really a candidate for fat grafting. And sometimes patients who want more of a full buttock, sometimes they just don't have enough fat to actually harvest and transfer over that area. Or in some patients, because of certain medical history that they have, are not good candidates for fat grafting. The other thing is that sometimes what we want is we don't just want to make it bigger. We want to create a certain shape to the buttock region, and certainly sometimes fat doesn't have enough support to give it that type of a shape. Butt implant is really a powerful tool. Certainly there's been a lot of advancement in what we call gluteal augmentation. For the breast, we use what we call gel-filled implants, meaning there's an implant and there's a shell, and inside there's a gel-like substance. For the buttock region, however, because it's a weight-bearing area, what we need something a little bit more solid. So these implants are made up of silicone solid implants, but they're soft. But they certainly are more sturdy, and they have certain conforming shape to them, which actually provides the support for ultimate shape of the butt. So gluteal augmentation in the past used to be a little bit more of a difficult procedure because we had to make a larger incision, because these are solid implants that we had to put in through an incision, and there was a lot of downtime associated with that. Like a lot of procedures that we are doing these days, we're doing it in a more minimally invasive procedures and methods. And instead of having to visualize it directly with your eyes, what we do is that we utilize camera. So this is what we call endoscopic technique. And by endoscoping, what we mean is we make a smaller incision and we insert a small camera so that we can visualize the entire field. And a lot of times we can visualize the field even better than actually looking at it directly with our eyes, because the advancement in endoscopic optics now is so far ahead that the resolution that you get is really incredible. And so using this endoscopic technique, we can more easily and more precisely dissect the pocket where we need to insert this implant. And there are a lot of little nuances about the butt implants. Sometimes we put these implants above the muscle, sometimes we place it behind the muscle, and sometimes we put it underneath what we call the fascia. And it really is dependent on how that patient's features look like. And so, all of these obviously are part of an extensive consultation that patients need to do. Well, thank you. I hope that this has been helpful. And again, as I stated, I think fat grafting is very well known, but sometimes we overlook the fact that there is another alternative and options to fat grafting for butt augmentation, and that really is these implants. So give us a call, and we'll be more than happy to explain to you about the different options that is out there for butt augmentation. Thank you.